Good morning, Dave.
Good morning, Cynthia.
How are you doing? How is it at your end?
Yeah, no, I'm really good. Thank you. And yourself?
Yeah, doing great as well. Nice to finally speak with you. Okay, so can you introduce yourself?
Okay, so my name's David. I'm a first year STP trainee in Respiratory and Sleep Science, and yeah, I'm about 9 months in, loving it so far. And that's just a brief introduction of myself.
Yeah, okay, so can you talk to us about your background as well?
So my background, so I studied my undergraduate Portsmouth, and I did exercise science. And midway through when I was studying, I got into a lot more clinical research and stuff. So I started volunteering here and there, and I worked for like a charity called Restart a Heart, where we just went around teaching people CPR.
Mm.
And through that, in my final year, I started doing environmental physiology, and then I got a research post with the Navy, and there were two things as like I did as a research assistant. One was like the effects of cold water and like the cold shock response in like respiratory and cardiac physiology. And then I did another one with the Navy where it was looking at lung volumes and anthropometrics in floating in water, basically. So yeah, I did those. And then as I was approaching my final year, my graduation and stuff, I was like, oh, you know what? I'm gonna go for the STP, and I applied, and by God's
Yeah.
grace, I managed to get it, and then
Well,
let's go.
so you got into the STP right from your undergrad?
Yes, I think I'm one of in my SCP cohort. I'm one of the youngest because I'm 22 now.
Oh
But
my god.
I know there's one 21-year-old I believe in that does medical physics. Yeah,
Wow, wow. That's really interesting. So, did you find out about the STP during your You said you did some clinical stuff. Was that where you
yeah.
found?
So I actually knew about STP in my second year of uni. In my first year, like I went to uni because I wanted to do something to do with like sports science or something to do with like biomechanics, sorry, which is like the physics and force behind movements, and but it's really boring in. But then in my second year, I met like a clinical exercise physiologist who took one of our modules, and I thought, oh wow, this is really interesting. But I personally don't like exercise. So I like watching sport, but I don't particularly want to do it for work. So then I started doing a bit of research of graduate schemes, and then I came across this. And when I read everything to do with it, I thought, this is what I want to do. From this point onwards, I'm going to tailor everything that I possibly can to try and get this first try, because when I first did research, I saw that not a lot of people get like going out of uni into get it in their first try and stuff. So I was just kind of adamant that I would do it, and I did. So yeah, man.
Wow, that's really impressive, and congratulations. I don't know if it's too late to say that, but it's really impressive. Yeah, yeah,
Yeah.
you knew what you wanted, and you went for it, and finally you're here. So
No,
that's
exactly.
okay. So when you say sleep science, the only thing I can think of asking is, what do you guys do in your specialty? Because I'm very curious, and
Yeah.
you started saying a lot of things about some physiological stuff. So I'm honestly interested, and I want to know what your specialty is about.
Okay. So I'll start with the sleep side first because I feel like that's the one you're more intrigued. So in sleep physiology, it's very, very close, and there's a tight intersection with neurophysiology as well. Depending on the level of sleep study that you do in your respiratory ward, they can range from home sleep studies where you fit patients with devices where they go home, sleep, and then you monitor what's happening, what's happening physiologically to them when the device comes back. There's inpatient sleep studies where you fit patients who are on different wards and stuff with different things to assess what their body's doing during their sleep. And then there's kind of like in hospital sleep studies where people will come into like a specific sleep laboratory and sleep, and then you sit in another room and monitor what's going on whilst they're sleeping throughout the night. And what it is we use it in order to see if there's any respiratory disorders during their sleep, more notably obstructive sleep apnea. So during our sleep, when we get the muscle atonia, where everything just relaxes, the tissue in our pharynx, our uvula, our tongue, everything around this area relaxes, and it can cause some airflow limitation or obstruction. When you have a partial obstruction, that's where you get the snoring and stuff like that from, which isn't the end of the world. But when you get complete obstructions, you start to get hypopneas and apneas. Hypopnea is just being where there's a slight reduction in the airflow that's causing detrimental effects to your blood oxygenation. And Apnea is where there's a complete obstruction going on, and sometimes you start to term it whether it's a centralized apnea where there isn't any drive from the respiratory muscles to try and breathe, or whether it's just an obstructive apnea where your body's trying to breathe but it's just the engine's not working basically. So when you do a sleep study and you're fitted with a lot of devices, what we do at my trust, we do just simple polygraphy where you monitor blood oxygenation, you monitor nasal airflow, you monitor positional sleeping, and then you monitor their respiratory effort as well. Just how much the muscles in their stomach and their thorax kind of act in order to create the space for the lungs to breathe and whatnot. So you get a trace of that. And have you ever seen like an ECG before?
Yeah, yeah.
It's all when like you're changing a radio channel and you see all that the squiggly lines. That's exactly what it is. You get different waveforms of different frequencies and amplitude based on what you're measuring. So you'll have a normal like oxygen and pulse rate as well and things like that. In more complex sleep studies, you have EEG monitoring that looks like action potential in the brain as well. But with ours, you just get your normal pulse, oxygenation. We get their respiratory effort as well in different traces, and we get their nasal flow in different traces as well. And we get a positional way to tell us what position they're sleeping in, because a lot of the time, when people have like respiratory based sleep disorders, it's just due to the way they're sleeping. They're just being absolute like whoppers or something, just sleeping diagonally or on their face or something. Then yeah, something bad's happen. But sometimes a lot of people they're completely normal when they're on their side, and then when they lay on their back, because you have gravity acting against you as well, everything just gets a bit compressed. Plus, when you're supinated, you kind of just compress the space in the chest cavity anyway. So yeah, it's a lot of we're looking to treat that really. And then sometimes with simple sleep studies that you use to diagnose obstructive sleep apnea or things to do with like obesity, hypoventilation syndrome, you can kind of see clues of other sleep disorders that require further intervention. And that's when you get the neurophysiology side. Because sometimes you can have people who they on their trace they just fall asleep instantly, and that could be a sign of narcolepsy, and they would need like a multiple sleep latency test or something to devise that. But then that's all neurophysiology. Or they have like REM sleep disordered behaviors where I don't know, there's something going on where when they're in deep sleep they're still moving around and things like that. So there's a whole plethora of things that are intertwined between sleep physiology and neurophysiology. But I'm sure you'll get a neurophysiology trainee at some point. He's talk to you a lot more detail about it.
Okay.
In terms of the respiratory side now, respiratory physiology is the main basis, just monitoring and diagnosing a myriad of different respiratory disorders using different tests and different investigations. And it's really good in terms of trying to see what a specific pathology has and how it's affected your breathing system, as well as to see how the efficacy of specific treatment or whatnot. See if this is good, is it bad, is it having any implications on this, that, and the other. And we do loads of different tests to kind of to encompass respiratory physiology basically. This is ranging from simple spirometry, an assessment of lung volumes, transfer factor that looks at the actual efficiency of the lung tissue itself in the alveoli and how efficiently they get in and out of the blood. We do, your simple blood tests just to look at blood oxygenation, see if there's any hypercapnic emergencies going on. Touch wood that I don't have to do that yet, because I haven't had a patient who's just in like type 2 respiratory failure whilst I've stood in front of them. There's a whole load of different things. We do challenge testing as well, where you administer different antagonistic kind of chemicals to people just to see if their air will react to it, to see if they're very hypersensitive or if they're normal. And yeah, and then that alongside our sleep studies as well. And we also do CPET testing, which is cardiopulmonary exercise testing, where we just look to see the changes in blood oxygenation, changes in the respiratory rate, and changes of heat to incremental exercise, so exercise that just gets harder. I think that's a good encompass of everything. I'm not going to waffle on too much, to be honest, but
Yeah, yeah. Honestly, I've not had anyone talk to me in depth about sleep science and respiratory physiology like this. So it's really interesting to listen to something I don't completely understand. But that's
yeah,
that's the good part of being on the STP Diary to hear from other trainees as well. So, what then would you say is the role of a clinical scientist in your specialty? Because I know that there are other scientists, healthcare scientists as well that work within your specialty. So, what specifically is the role of a clinical scientist?
Okay, so within respiratory and sleep physiology, the role of a clinical scientist is to monitor and diagnose different respiratory and sleep based disorders and analyze the efficacy of specific treatment against specific pathologies. I think that's the best way to put it. Because at the end of the day, when you have a patient, you look at your patient list, they're coming in because a doctor thinks they have something, or a doctor knows they have something and they want to see how bad it is, or they don't know what's wrong with the person and they need to build a big picture of everything. So you'll be looking at the heart, imaging, and from. So yeah, I think that's the basis of it. I think that's a good.
Yeah. Okay. So, what rotations do you do in your first year then? Because you're saying a lot of things about neurophysiology. So, do you get to do some rotations there as well?
Yeah, so we rotate across cardiac science, critical care, which is a lot of intensive care units, which is like a myriad of different things, whether it's like renal, cardiac, or respiratory. There's everything in there, to be honest. And then neurophysiology as well.
Okay. Then in your second year, you get to do your specialist stuff, I guess.
Exactly so. And I honestly don't know what that specialist stuff is. I haven't looked at it yet.
Yeah. Obviously, in a few months' time, you'll get to find out, I guess.
Yeah. Yeah, I'm trying to finish all the moment I can get rid of all my competencies.
Yeah, so talking about competencies and talking about knowing that the STP you have to do the university part. So how do you manage the competency and the university part of it?
Do you know? You know what? When I first discovered the STP, I saw that there was so many different like mental health advocacies for it. There were so many different support groups, and I thought,
Why
like,
do you need all that?
is it that hard? Is it that hard? And now that I'm on it, yeah, wow, it is a lot, especially because I think at my trust, I picked up things very quickly and was given a lot more responsibility very quickly. So the time where I had to do like things like where I could do competencies when I'm at work or something like that, it kind of diminished a bit. So I rely heavily on my study days and just get after I get home from work or get in work early to just chip away at different competencies very slowly. How I manage it is I stay very organized. Like when I first started, I have like a master spreadsheet as well as what they give you on one file of everything that I need to do, everything that I have done. So I kind of build it like a portfolio. So at the end, or when I want to go for future endeavors, I just have something that says, yep, I did this, I walked here, I breathed here, this, that, and the other. But I think when I have the spreadsheet and like I like multiple colors and things like that. So when I see things in green, red, if I see like they're in progress, like it helps me keep track of everything I'm doing. So I have like a systematic way where like one week I'll focus on the competencies, one week I'll focus on the university stuff, one week I'll take it easy and just like try and just focus on work and then my own spare time and then rotate between that. I think it helps to try and manage it with the work really.
Okay. So what university do you go to?
So I go to Newcastle University.
Yeah. Okay, I go to Manchester.
Oh yeah.
Most of the people I know go to Manchester as well. So you're the
Uh,
first.
there's one other STP in my trust, and she goes to Manchester.
Okay. So where is your trust? I don't think you've said that.
It's Frimley Health NHS Trust. It's based in Surrey.
Sorry. Okay.
Yeah.
I honestly thought you were based in London.
No, no. So I live in Greater London, and I just drive to Surrey because it's not very far to be.
It's not very far.
Yeah.
That's good. All right. Let's take it back to the base where it all started from the application. So from what you've said so far, you found out about the STP in your second year of university, and then it seemed like you knew what you were getting into and you kind of prepared for it. So talking about the STP application, what was your application experience and what advice would you give to people that are preparing towards the application next year and how to prepare an outstanding STP as well?
Okay. I think the actual applying yourself and wanting to do it doesn't start when the application's open and you have your 1 week deadline to apply, basically. I think it starts from a little while back. you need to make sure you have the capability, you're in the right space to chase after this. Because once you apply, it's not like you find out if you get it or not. You're waiting an odd 6 months and you have things in place really. So I think to start off with, it's doing your knowing the exact role that you want to do, knowing its implications, knowing what you want to do as well. Because if you just want to do it because if it's something to do, then you may be in for a bit of a shell shock because it's a lot. You're applying yourself and you're committing yourself to a place and something for 3 years, which is quite a long time. And you need to make you know what you want. And when carrying out your application, I think it's all well and good saying yes, I did this, I did that, I'm this, I'm that. Like, but at the end of the day, especially depending on the specialty you're going into, your respiratory and sleep is heavily patient facing. They will 100% take someone who's passionate and willing to learn with a growth mindset over someone who believes that they just know everything already. And I think that was a major factor in my application because it was just so bare. When I applied, I didn't even have my degree. So when I was putting my education, I felt like my A levels and then to be confirmed, I had my degree. But it's just, if you just come across raw and passionate about what you want to do, and kind of display this as about how the STP can help you, but how you could possibly help the STP and what you could bring, then I think you're set for a great application in that way. In terms of the things you need to do, especially if say you're like me and you want to do it after uni, I think volunteering is massive.
Yeah.
Volunteering is massive. Luckily, my mum is a nurse. My brother's a physiotherapist. Like they all work in the NHS, so I was able to get like shadowing gigs here and there, like shadowing in respiratory and sleep physiology, shadowing my brother therapist, or even just helping my mum out sometimes, yeah, in the admin side of her hospital where she works at. As well as that, volunteering for as many charities as you can. Like I mentioned earlier, like I worked for a charity called Restart a Heart. I did like presentations at my uni for this charity called Lymphoma Action. I worked food banks as well and that was through like my football team at university and stuff. But it's just volunteering, showing that you can dedicate your time to something that you're passionate about. That's really going to bolster up your application, I believe.
Okay. Yeah.
Uh, so yeah, volunteering, making sure you know what it is the role is, and you're passionate about it, and coming across as a passionate applicant rather than just another number in the pool of I honestly don't even know how many people apply for the
Yeah.
STP. Like there must be multitudes of people, so you have to really think deep with it and try your best and be as passionate and raw as possible, just so you know you've tried your best, you've controlled that. Because when it then comes to the SJT, boy, you know
That's
what?
another story entirely.
Yeah, when honestly you with the SJT, the way I did it is I really internalized the NHS values. Like when I say I had a white in my uni room around the time it was coming out, like I had it written everywhere. Like the NHS values were everywhere. Like I knew them off by heart at that time. I only remember like a couple of them now because my trust had different ones that I need to remember and stuff. But like I knew them off by heart to a T. Like I had them written everywhere. I knew the implications and I'd make up like stories based on every single value and scenarios based on every single story. And like as like practice, because I didn't know what to expect, I just applied for some NHS jobs knowing that I wouldn't get it because I don't have a degree or anything like that. So I just applied looking at how they structured certain questions and things like that. I went to my careers advisor as well, who had no idea what the STP was or any idea how an NHS application would work. But then it just asked me really specific questions. And what is crazy that I did, like I asked ChatGPT as well, come up with a few questions like this. And honestly, if you use it smart rather than trying to make it work for you, it's very, very good. Like I use it for revising as well. Like for example, if you have a slide learn, you can copy the whole slide, put it into ChatGPT and say, oh, make a multiple choice questionnaire out of all of this.
Yeah, I do that as well.
Very, very good. But yeah, I used ChatGPT and I embedded the NHS values into it and said, yeah, ask me scenario based questions that all healthcare professionals would probably be asked in a 60 question exam. And I just went through that a bit, always picking the one that put the patient first and the values first as well. And yeah, so I sat it and I did it in like the most chill way possible. I remember like waking up the morning when the SJT was kind of like out and about. And I remember like I was meant to go to uni and I just didn't go. I just sat at home and I kind of just did it and then carried on about my day. And I had like kind of like a feeling that that it went well. Like, because there weren't a question, there wasn't really a question that I was like, oh, do I need to change my answer? Like, I was strict on myself, saying if I pick an answer, I'm going with it. Because when you go to work in such a specific endeavor, you have to be very specific. Like, I can't decide to do a test on you, see that it's killed you, and then say, oh, I'll do another one. Like, it's already been done. That's probably not the best analogy, to be
I
honest.
know, I know, right?
Yeah,
But I got the point anyway.
yeah, like, and I think that's fine. I think the best thing, oh, I should have mentioned as well, with your application, find a mentor, find someone who does it that can help you through it. I had a great mentor. Like, when I was first starting out and I messaged every single person I could find on LinkedIn, only one guy got back to me. Yeah. And honestly, he changed my life. Like, he's the best guy in the world. He's a respiratory and sleep trainee as well, but he's in a second year and he worked as a physiologist already and just decided to go onto the STP just to gain higher qualifications. But yes, he was the best thing that happened to me in terms of this in this endeavor. And honestly, if he never let me shadow him, like I would not be where I am today. Wait, well, I keep saying he. His name is George Bingham. He works at York. Yeah, honestly, if you
Oh my
know,
god.
if you know him, just go up to him, shake his hand, man, because that is a top guy. I think that's why I even started like my page or started helping people because honestly, if we had more of that a lot of the issues we have in healthcare science, it being very like not well known about, would be solved. I think there's no need to like gatekeep it or anything like that. We need
Yeah.
more staff. We need more people who are interested. Like so, yeah, no, man. Like especially like if when you're doing something you enjoy, like if you love your job, talk about it. Like
Yeah.
it's a really big thing. If you love it, talk about it.
Oh my god. You're so passionate about what you do, and it's very
Yeah.
evident from the way you speak, from the way you talk about it, and how far you had to go for the STP application. Like, wow. And for the person you reached out to on LinkedIn, I'm definitely going to clip this part of the video and I'll tag
No,
you on
honest, no,
it
honest,
because he deserves his flowers, really.
George Bingham is the boy. Like honest, like he's the kind of person, yeah. If I ever see him again, like I'll probably see him at a conference or something. But he's one of those. If I see him, like I'm buying all of his drinks for him, like serious, like every pint that I will buy for him, bro. Like it, because just like little acts of kindness there can just start a shift. Because he helped me get where I am, and I've helped like so many different people with their application stuff, and like I'm really thankful that they're waiting for interviews. They're really confident that they'll get it, and if they can get it, they can then go on to help someone else and things like that, and then so forth and so forth. Like it's just a nice way to do it, really, especially in something like the STP. You will not do well if you solely try and just do it on your own. Like you need support. You need people.
you de- you definitely burn out. I think there's been a difference recently having a lot of people out there talk about the ST because I really struggled during our time and you're there online, you're not seeing people, and then you're struggling to envision the role. I think that was my major struggle. I couldn't figure out what do these people actually do. It's mainly like theoretical, what you see on Google, you're just reading, trying to imagine. So it's part of the reason why I do what I do as well. So just let some people apply and just know what this is actually about. And honestly, the STP is very intense. There's no point keeping it there. Like you have to see, we have so many things to read,
Honestly,
so many things to struggle.
because I can't lie. Like I didn't know how intense it was. I knew it was intense. I knew it was hard to get into. But when I got there and I went on one car for the first time and I saw that I'm already 40% behind in something, like I just got it. What do you mean?
Yeah.
And then like especially I like this year the university side like really it had me like I was struggling like when I did my exams, like in all honesty I thought I'd lose my job. I thought I was having to retake something, but I don't know why, but it's because like not to sound like boasty or anything, like going through uni, like I could kind of go to lectures, not go to lectures, have maybe a couple weeks notice, and I'd get a first in an exam. Like it's fine. It's because I knew I was passionate about what I did and I was good at it. So Like I could learn it very easily. I think this uni experience or the SP's experience is the first time maybe since like I was in year 9 where like I've gone into something not 100% backing myself. Like mind you, I got really really good grades for my exams and I'm really grateful for them. But I don't know why, but I had no confidence in myself whatsoever.
I
Like
can't I can't believe I relate perfectly to what you are talking about, because after my last exam, I just came home. I told my husband, like, I can't believe I dropped from an A student. I can't tell how. Well, I'm not. I don't mean to scare anyone out there, but it's good to have an understanding of what you are getting into. Like you said, I knew the STP would be intense, but nothing prepared me for what I would face. Like, it's a real struggle, but we're getting
honestly,
through
like
it.
it's just, and then when you try to get on with the work and do it, you find you're doing too much. Even like, I think one time I was with my girlfriend. We were getting ready to go out, and she was like, "Oh, okay, yeah, just give me a sec. I'm just gonna like just do my makeup, and then we'll go." I was there, sat in like my going out clothes on the edge of my bed, like on my laptop, doing competencies. I'm about to go out on a date, and I'm here doing my competencies. Like sometimes you could slave to wanting to get it done, and it's hard to balance. But
But
there's always a good way to do it.
it's all good. The older trainees in my trust, they keep telling me it will all come together over time. That it's just to take it easy on yourself as well. So yeah, I think we'll get there. So
Like I've always been, I've always been a big like believer in like, oh look, at the end of the day, it will work out. And if it hasn't worked out, it's not the end of the day. It'll work. Like it'll work. Like for me, I refuse to go onto one file now. Like I just do it, upload it, and then X out of the tab again. I don't look at no percentages or anything like that. I just do the work, and then it just works better like that for me.
I think an advice I got that has really worked for me, and then you can look into it as well. Someone said that you ensure you do competency within work time. So I try not to. They are really supportive at my trust as well, so they don't give you so much, so you get enough time at work to write up your competencies, because if you try to use your study days for competency when you have exams and when you have uni stuff, it will make the competencies to pile up. So I think getting it done at work for me has been very helpful and has reduced a lot of stress on me as well.
I think because we're a bit of a small team, and we're starting to expand now because I think the service we're providing it's starting to grow. We're starting to get a bit more specialized and start incorporating broader ranges of tests like that. So when I started, and like I think it took me a month, I think, to start seeing patients like with like my supervisor there, but them not interrupting a lot or something like that, which is fairly quick. So I think the more I got better at it, I took on a lot more responsibilities, and like I was like, oh yeah, no, I'll come in early, do this. Like I started doing some like weekend clinics as well. Yeah, like I mean, I wouldn't want it any other way. Just because sometimes it's tight, I don't get to do my competencies at work. Maybe here and there, if it's like super quiet, like we're having a servicing in the morning, and we'll say, for example, data analysis has already been done, then I can sit there and get some work done. But that's very like once in a blue moon kind of thing. But I like how everything is. I'm just very lucky that I got the trust that I got because I think the trust that you're at just defines how your
Yeah,
experience
yeah,
will be. I've heard
100%.
so much good and I've heard so much bad as well. Like I'm just so thankful for my training officers and my colleagues and stuff because they're very motivating. I know.
Okay, let's talk about the interview, because I know they are currently doing their interview
Yeah.
and everyone out there is looking for the best tip they can get. So, can you tell us how you prepared for your STP interview?
Okay, so I'm going to. This is going to sound very creepy, but a week before my they emailed me telling me who's interviewing me and what trust they were from. Because when I did interviews, there was the first year of them being competitive, and the trust that was interviewing you wouldn't necessarily be one that you picked.
Yeah.
So I found that I was being emailed by, I can't remember their name, but I remember they were from King's College. That moment, I searched on LinkedIn, searched them up on Twitter, searched them up on Facebook, searched them up in Google, everything. I had to know everything about what they did, what their role was, what kind of research outputs they may have, and what specifically they like. And then I looked up King's College in general. I looked at what studies that they've conducted to do with respiratory physiology or like all respiratory, biomedical things and whatnot, like things like cells and genotypes that predict respiratory disorders. I looked up everything that King's College possibly could, just so I had some things to talk about and some things to relate to you about. Like I think, like even something as small. I don't know if this is like relevant, but like even something as small as that, I found out like one of the interviewers really liked horse racing. So I said, yeah, no, I like watching the horses race too. Like that stuff like that. And so that's how I prepared in terms of like getting to know the interviewer. And then I made sure, like I've always done it in my interviews. Never even I don't know worked at Five Guys or if it was when I worked at this job here. Like I always made sure I had questions for them. I think having questions is really important because it's very easy to look over them, but it shows that you're genuinely interested. You want to know how you can progress or how you can adjust yourself or adjust the actual role itself. So having questions is a big one. Once again, NHS value. Just have to really like honestly tattoo them on yourself if you need to. Like
Yeah.
like NHS values is a big one. Just have an idea or a scenario in your head that every value, and then the person specification that they actually give you on the national website, like it's a cheat code. It's an absolute cheat code. You if you just really individualize yourself into that person specification. Don't just come across like a robot, but take away that person specification that can exemplify the person you already are, and then you should do great. And then another thing in the interview itself, like it's okay to be nervous, like it's okay to be like to not have an idea or not know the perfect answer to things. Like I remember in my like I was sweating and I told the person, oh, honestly, I'm sweating, like I'm so excited, like and like at the end of the day, it's not like you're being interviewed by computers. They're actual humans with feelings, emotions, and if they work the job they do, then they're capable of exercising empathy, so they know how you feel and whatnot. So it's okay. And a big one is have an idea. You need to know about the job, know the basics and fundamentals. Like if you're going for a job in physiological sciences, like what I did, know even if you're going like that, know some a bit of respiratory, know a bit of know a bit of ECG knowledge, know a bit of treatments and what a day in the life of a physiologist would, just so you seem a bit well rounded. Because at the end of the day, they're not looking for someone who knows everything. They're not looking for a fully registered clinical scientist. They're looking for a trainee mold and shape into the best version of what that role could be. So don't have to be perfect. And then so much. But and then if you get an answer wrong or you definitely don't know it, don't say I don't know.
Okay.
Speak out loud your thought process. So like I remember in my interview at the time they asked me, what's the best treatment or medication for obstructive sleep apnea? I have no idea. Just because in my degree, sleep only looked in like the circadian rhythm and that kind of thing. The best we ever touched on it was like kind of mental health disorders that can affect sleep. That was the most. But I knew obviously it's obstructive sleep apnea. You can get if quite a high BMI. You can get it if you're going through different things, or if you got really big tonsils and stuff. So what can you treat it? I know the CPAP machine, but that's the only one I know. And they were looking for a bit more than that. But like just like that, if you talk out what you think it could be, it's good. Because at the end of the day, you're problem solving for work. So they want to see if you can at least attempt to problem solve. And then yeah, I think that's it really, to be honest.
Well, that's a good one. And I honestly appreciate the fact that you talked about not telling them you don't know an answer because it's kind of going to look weird and looks like you don't know what you're doing. So it's good to kind of say something around the
Yeah.
topic rather than just tell them you don't know. So thank you very much for
Yeah.
that detailed prep. Right. So what advice would you give to someone applying to your specialty next January?
Wow. Oh, this is a just make sure you're doing it because you love it. Like you respiratory science, learn more about sleep science. Stay organized and just take every day as it comes. Because you're gonna have days where you're really great with the things you have, and then you're gonna have days your confidence will get a bit knocked because you'll have really difficult ones where you may need to ask for. And yeah, so just take every day as it comes, stay organized, and make sure you're passionate. That's it, really.
Okay. So, in conclusion, what's the favorite part of the job so far?
Oh, it's hard. I think favorite part of the job is it's the patience. I think it's the patience. Like I meet so many different people. I've had like pediatric patients. I've had like geriatric patients. Like I've met someone who's at peak fitness and they're 98, and I've met people who are like 21 and they're really struggling with their health and stuff. And it just teaches you to be grateful and interacting with them. Like the way I am with patients, like I'm very like I try and appeal to their sense of humor. I let them know everything I'm doing. Give a talk of the science, but in a bit more of like a appropriate way. That's funny as well because I think they're to the hospital all the time for these tests and stuff, and hospitals aren't notorious for the amount of comedy and fun you have there. So yeah, I think I just like talking to people and I like seeing them get better basically. So yeah, it's got to be the patience, man. I even appreciate the rude patients, man, because I'd be in a bad mood too.
Yeah, yeah. Well, yeah, thank you very much. It's been awesome speaking to you. I really appreciate your passion for what you're doing, both for your specialty and for your social media. And thank you for telling us about how far you went with your application and the preparations you made. I hope someone would learn from that. Thank you very much. I really appreciate your time and thank you for doing this with me.
Well, thank you for all that you do as well, man. Like I wish I found your page like before I was on the STP Discord. But no, thank you so much for everything you do, and yeah, it's been great speaking to you.